So many thanks for your time this evening. Welcome. Thank you for allowing us to provide you with a brief overview of the Health and Care Staffing Scotland Act 2019. This is new legislation that will need to be considered from April this year. My name is Joanne Duncan and I joined the Safe Staffing programme last summer on a secondment from the inspection teams. I'm joined on the call today by my colleague Candice Aitken, and we are working together to support all childminding and daycare of children services to prepare for enactment. The Safe Staffing programme was commissioned by the Scottish Government to support care services to prepare for the introduction of new legislation, the Health and Care Staffing Scotland Act 2019. Now, this is the first legislation in the UK to set out requirements for staffing for both health and care services. The Act itself aims to enable high quality care and improved outcomes for people using services in both the health sector and social care sector by helping to ensure appropriate provision of people who provide care for children. There will be changes to current legislation used for regulatory purposes, those changes being the redaction of Regulation 15 from the Scottish statutory instruments, which you're currently regulated against at the moment. So I'll review that with you as part of this evening's presentation. Now, this legislation is applicable to all services who are listed in Section 47 of the Public Services Reform Scotland Act, which includes all childminders, not just those who employ assistants. Now, as childminders, you have a vital part to play in providing the best possible outcomes for children. The service that you provide is very unique, it's flexible and often tailored to meet the needs of different children and families' needs. We very much value the hard work that you do, which often includes really long hours, so we do really appreciate you taking time from your evening to join us to hear about the upcoming enactment of the Health and Care Staffing Scotland Act. We're using an online platform this evening called AHA Slides, so you'll see the QR code on the screen, and this allows the presentation to be interactive. So if you can, please scan the QR code, which will allow you to interact with the presentation and take part in some of the polls and questions that we'll be asking today. We've also put a link in the chat for those of you who don't have another device or the ability to use the QR code. So if you click on the link, this will open up in a new window and allow you to follow and contribute in a new window. Next slide, please. Before we start, I just wanted to go through some housekeeping for our event tonight. Today's session is planned to take 1 hour. As we are recording the webinar, I would be really grateful if you can keep yourself muted just to avoid any interference. And finally, we do have a large number of people on the call today, so we would be grateful if you could keep any queries or comments, hold these until the end, and we will provide an opportunity for you to share those with us. That'll just avoid any comments being lost in the chat function. Candice is here supporting, like I've said, and Candice will be entering some links in the chat function as references as we go through our session today. So that will just ensure everyone can access the links required. Next slide, please. Thank you. So if we could try and use the code now and test if we can access this, please. As we are a commissioned programme from the Scottish Government, we do have data to provide, which we're gathering from 2 polls today. So we're really grateful if you could support this by answering the first poll. I can see a lot of people accessing that already. Thank you. So there's some people completely ready and somewhat ready. So you've obviously heard a little bit about the legislation just now and you feel ready, so that's great. If you're not sure and you're not ready, that's also fine. We're here today to try and raise awareness and develop your understanding and confidence with becoming ready for the enactment of the Health and Care Staffing Scotland Act when that's enacted in April this year. So thanks very much. I'll just let everybody else contribute to that poll. This isn't about judgment. This is really just for us to gather some data for the Scottish Government, really to measure our impact, not yours. So thanks very much for contributing to that. So for our session today, I'll provide an overview of the Health and Care Staffing Scotland Act to support you to prepare for enactment in April this year. We'll look at the guiding principles of the Act, and we will go on to review the current legislation that you're regulated against at the moment Regulation 15 from the Scottish Statutory Instruments and discuss its similarities to the new Act. And finally, at the end, we'll have some time to share some further learning opportunities for you. Next slide, please.
Sure, Joanne. Before I change slides, the chat function is not currently working, so I've put the link in any other links. I'm going to have it in the Q&A section. So if you want to access that link, it will be in the Q&A section.
Thank you.
You're welcome.
So we know that the foundation for improving children's outcomes and providing quality care is based on the quality of people providing care for children. The training and values of individuals underpin the quality of experiences and opportunities that children receive every day. And the Health and Care Staffing Scotland Act has a focus on valuing and appreciating all individuals providing care for children. And we are here to support and guide you through this legislation today, highlighting good practice already happening within the sector and celebrating the fantastic work of childminders. Next slide, please. So I'll start with an overview of the Act as a whole. There are 4 parts to the Act, which you can see on screen. The first part affects the work of all services registered with the Care Inspectorate. These are the guiding principles, which we'll cover this evening. The second part is only applicable to services in the NHS, so they do not apply to services that you provide or that we regulate. The third part is applicable to care services again, and this is where we see the similarities with Regulation 15, which is the current legislation. Now, Chapter 3A there within Part 3 is only applicable to services who use a staffing method framework, which at the moment are care home services for adults. There is a caveat in the legislation that Scottish ministers may introduce this in other sectors in the future, but this would need to go through extensive consultation processes with stakeholders, and the Scottish ministers have not requested that we introduce this in the daycare of children or the childminding sector at this time. Part 4 is a short part of the Act and identifies the ancillary provision, which really provides for the commencement of the Act. So this part doesn't hold any expectations from services. So we can see here that although the legislation is quite lengthy to cover all aspects of services that it affects, it's really only Parts 1 and the first section of Part 3 that is applicable to childminders and those working in the ELC sector. So that's what we'll focus on today. Before we move on to the parts of the Act that are applicable to childminding services, I just wanted to show you the image for the staffing method framework that I've mentioned there in relation to Chapter 3A. Again, this is not applicable for your service, but if you log on to our hub page or if you see any information online about this legislation, you will see this image because it's quite a big change for the adult care home sector. So we felt it was better to show you the image so that you can identify that it doesn't apply to your service. There are some good elements in the framework we may find that we're already using within the childminding sector, but the use of this framework is not expected and it will not be mandated from April for our sector. Next slide, please. So back to the parts of the Act are applicable. Part 1 of the Act tells us about the guiding principles, and these apply to all social care services, including all childminding services. Now, the Act states that the main purpose of staffing for health and care services are to provide safe and high quality services and to ensure the best care outcomes for people who use services. And the rest of the Act is really about making these main purposes happen. When we are considering this legislation and the wording in the Act, when it refers to staff, this includes all individuals working in the service who provide care for children, which in many cases are yourselves as childminders if you're working on your own. So when it states the main purposes of staffing, it's referring to the main purposes of the service that you're providing. Of course, when you do employ assistants, this would also refer to ensuring the people that you employ in your service are employed in order to meet these main principles of their role. So you should be considering how these guiding principles are used to develop and deliver your service, and then when appropriate, when you're making decisions about the staff that you employ as assistants. So in order to achieve these 2 guiding principles, the Act provides 8 principles that should be looked at holistically in order to achieve this. These 8 main principles are on the slide and feature in Part 1B of the Act. These main principles of the Act must be considered when you're arranging and considering your own service delivery in order to achieve the 2 guiding principles that were set out in the last slide. Now, most of these headings are similar to the current expectations, and you will be able to identify areas of good practice within your own services in these principles. So with the introduction of the health and social care standards and the quality assurance processes that you'll have in place, you'll already be working towards the first principle of improving standards and outcomes for children. The second principle of taking account of individual needs is something many childminders do very well with their personal planning. I know there has been some training available last year for childminders through the SCMA on children's rights and participation in practice. And promoting children's rights is something, again, many childminders speak really confidently and passionately about. And we've seen many ways that childminders have established meaningful ways of involving children in their services and supporting children to recognise their own rights. And all of this directly relates to the third principle of the Act. Now, what we were really keen to do is ensure that this presentation supported childminders, and for us, this needed to be demonstrating this legislation in ways that you can see yourself and your service. We've already identified the uniqueness of childminding and the real valuable offering that you bring to children's care and their play and learning experiences. So what we've done is adapted the wording from the main principles here to show you how these affect your service if you're working as a sole childcare provider, and for those of you who have assistants, how you need to support them. So the adapted wording for each principle can be viewed on this slide. So you can see that the fourth principle here, for example, on the right-hand side of the top row, is about taking account the views of children and staff. Now, we've reworded this to read taking children's views into account and assistance if applicable. Childminders know children in their care very well, and I know you will be considering children's views as part of your normal practice. And the wording here demonstrates how assistants' views should also be taken into account if they're employed in your service. You'll already be demonstrating through your self-evaluation procedures how you listen to and consider children's views. So it's just about ensuring you seek and consider the views of your staff too, if that's appropriate for your service. If we can move to the next slide, please. One principle we wanted to draw your attention to is an addition to current legislation. This is Principle 5, which is staff wellbeing. We've reworded this one to state looking after your own wellbeing and assistance if applicable, because we felt that was more appropriate for childminding services than the wording in the legislation, which is staff wellbeing. Now, many of you will work individually and independently with children and families, so it's extremely important that you consider your own wellbeing in order to provide safe and high quality services and to ensure the best care outcomes for children. You have a responsibility to ensure that you're keeping your skills and knowledge up to date in order for you to be confident in your practice to enable that high quality care for children. Our national guidance documents that we all work with, such as Realising the Ambition and national frameworks, including the Blueprint, which documented the Scottish Government's vision for the expansion of ELC, all recognise that a high quality workforce is a key driver in providing high quality care. As childminders, you are your own services workforce, and you're accountable to ensure that your knowledge and practice is based on current research and up to date, and that's an essential element of enabling you to provide high quality care. In terms of evidencing this and adhering to legislation, this doesn't require you to add any further elements to your processes. If you do employ assistants, you will already be keeping notes of any training or development opportunities that you're providing and keeping track of any discussions you're having to work towards achieving the best care outcomes for children, whether that's reviewing children's personal plans together or documenting reviews to discuss children's next steps or progress. In terms of inspectors assessing this for you, we won't be looking to discuss your personal well-being, but we will be having conversations about how you're keeping your knowledge up to date and asking of any networking groups that you may attend, such as toddler groups or childminding groups, because these all contribute to sharing ideas and best practice and demonstrates what it means to be reflective practitioners. When considering this principle for assistance, the focus is on staff wellbeing insofar as it affects the main purposes of providing safe and high quality services and ensuring the best care outcomes for children. The important thing that you should be aiming for is that it's safe for assistants to raise issues without fear of retribution, and that there's a culture of service improvement, transparency and open communication, whether you're working on your own or with others. Move on to the next slide, please. So now what we wanted to do was look at two of the main principles in more detail, just to give you an idea of what's involved, and so you can share some of the really good practice already in the sector. So we can go back to our other device and scan the QR code and think about what you do already in your services that enables or supports you to improve standards and outcomes for children. So this is based on the first principle. So this is us all working together to identify the elements within our services that we would need to identify to meet the requirement of the first principle. So I'll just give you a couple of minutes to have a think about that. Personal care plans, yes, so you're keeping those up to date. You're looking to improve standards and outcomes for children. Personal development plans, next step, feedback involving parents, and you will be involving the children as well. By attending training, absolutely, you're all coming along tonight to make sure that you are keeping your knowledge up to date, which in turn improves standards and outcomes for children. There's some people doing some questionnaires, that's great. Parent-child, there's a lot of people doing parent and child questionnaires. And when you are working with your colleagues, your childminding colleagues, you know, if you're in toddler groups or if you're in childminding groups, share this information with each other, because you'll be able to share some really good ideas. Build relationships with children and their families to create open and honest feedback channels to keep children's interests at heart. Absolutely, that's brilliant. And that's, you know, that you've summed that up in a really lovely sentence, but that's taken a lot of work. So it's about really reflecting on the hard work that you've put in to achieve those channels. So that's great. Partnerships with parents, and there's so many different ways that everybody does that. So again, celebrate that success with your other colleagues in the sector and share with them how you've managed to achieve such good partnerships. There's so many coming in, this is great. Observations and discussions, rotating toys and activities. That's a really good point actually, because it's very difficult to not let the childminding actually take over our whole home. You know, we do need to remember that this is our home, and it's a really good way to do that by rotating the toys and the activities. Listening, networking with others. It's nice that you're already doing that. There's somebody got a WhatsApp family group to keep both parents updated with photos. That's lovely. Private Facebook page for other childminders. And this is all for other childminders. That's great that you are doing lots of networking and you can share ideas. And all of this is about your contribution as your own member of staff effectively to work to improve the standards and outcomes that you have for children. I wondered if anybody did have any staffing, what they do to support their staff to improve standards and outcomes for children, if anybody does work with any assistance. I'm sorry if you've already put that in, I've missed it, I'm sorry. Visits to other childminders, nurseries and playgroups, that's a really good idea. So there's lots there, staff training plan. Okay, staff training plan and feedback on staff, brilliant. So you're employing assistants and you have a training plan. And it's about reflecting on how you're identifying the best training for your staff, your assistants. If you're doing that together, working with West Lothian College, that's really interesting. So there's lots of really fantastic work underway in the sector that you can already identify that you're doing so much to improve standards and outcomes for children. Regarding the nurseries, chatting with nursery teachers regarding the Mind we share. And again, that takes time to build those trusting relationships with other childcare providers to make sure that you're offering that consistent approach. Joint planning, great. This was a really good one to get you started to think about improving standards and outcomes for children, because you already do so much. So thanks so much working with the council childminding officers. Great. Thanks very much for sharing all of that. We're just going to move on to the next one. I think we could have contributed all night there. There's so much fantastic practice going on in the sector. Thank you so much for all of those contributions. What we've done on this slide is give suggested areas for consideration where we felt that this principle is already linked. So we've provided a couple of the health and social care standards and an area of the quality framework that has a direct impact, we felt, on improving children's outcomes. So these are just suggested areas, and you may feel that there are other standards that would relate to this principle. These were just suggested standards, which I'm sure many services will already be evidencing how you're meeting them. So it just linked it to some of the standards in the quality framework. So thanks very much for that. We're just going to move on to another one, and we're going to have a look at another principle. So if we move on and have a look at principle 5, this one in the legislation is written ensuring the wellbeing of staff, but we've reworded this one as looking after your own wellbeing. And of course, that would be and assistance if applicable. So let's have a think about how you look after your own wellbeing. And of course, for those of you who employ assistants or staff, how do you support your staff's wellbeing when you work so closely together? Reduced working hours. So that's, have you made a conscientious effort to make sure that you're not having such long days? And that's really difficult to do when you're trying to work with so many different families. Yeah, it's so important to have that open dialogue with parents. You got a puppy, that's lovely. Working closely with other childminders and to support each other, that's really important. It's not an easy role that you have. You've got a very complex role. So to support your other childminding colleagues, that's great. Some days reduced to 4 days a week. Don't be afraid to say no. That's a really good one, but it can be very difficult when you're trying to please everybody, because a lot of people, especially if we're in smaller communities, look to us for the answers, don't they, if they need childcare. Delegating where possible, yoga classes, self-care is massage, allowing time for training and paperwork by only working 4 days a week. That's a really good one as well, just to point out that if you are spending time focusing on, improving standards and outcomes, then you're building your own confidence as well, which in turn supports your own well-being. So the principles are interlinked. Having your own hobbies and interests, nights out with other childminders. Remember, you're self-employed and you're the boss. Yeah. So offer counselling sessions if required, monthly team meetings. This would be for people who have assistants, creating a safe work environment and team nights out. So that's great that you've obviously thought about that already, about offering the counselling services to your assistants, and you're making that time for the monthly team meetings. Limiting your paperwork, absolutely. We don't want any duplication of paperwork. And what we were saying earlier about the quality assurance processes that you'll already have in place, this legislation shouldn't be asking for any additional paperwork. You should already be having systems in place that you'll be able to link this to. So it's just about getting your becoming familiar with the different principles and what you already have in place, and perhaps identifying what it is that you need to just make slight improvements or tweaks with in order to identify the different principles and how you would meet them. Taking less children to improve standards of care to existing children, that supports your own well-being, absolutely. And that's about identifying what is achievable with yourself as a sole childcare provider. Separate playroom means I can close the door at the end of the day, absolutely. Being part of a childminder group and having support of other childminders. So we can see here it's really about that culture of appreciating the work that you do and working together and making sure you are leaning on your colleagues for that support. There's somebody who's a member of the SCMA, so you can also get support from member organisations if you're members with them. So we can see by in turn, looking after our own well-being does have a direct impact on the quality of experiences and outcomes and the safety of the children in our care. Getting outside in nature, that's a really good one as well, and something that the children really love to do. So thanks very much for all of your contributions there. That's really great to be reading all of those. There's still more coming in. Outdoors is a big one, yeah. So thanks very much for all of those. What we've done on the next slide, still some coming, that's great. On this slide again, what you'll see that we've linked to some health and social care standards again, and areas of the quality framework which you're currently regulated against at the moment. So if you have processes or procedures in place that are already linked to these standards, you may find you already have systems in place that support you to look after your own well-being, insofar as it affects the guiding principles of the Act to provide safe and high quality services and to ensure the best care outcomes for children. So I hope this is demonstrating that this legislation is not seeking any innovative models of delivering your service, and that you might already have measures in place that would support you to already meet the requirements placed on you by the Act. So we just move on to the next slide, please, Candice. Thank you. That was a brief overview of part 1 of the Act. And before we move on to talk about the next part applicable for your services, part 3, I wanted to discuss the statutory guidance. Now, this accompanies the Act. It's been developed by the Scottish Ministers to provide practical information and support services in meeting the requirements that are placed on them by the Act. The statutory guidance can be found online. It is quite a lengthy document, and it's still in draft form, as the Scottish Government had this open for consultation between January and September last year, and the review has just been released. So the document provides clarification on some terminology used within the Act, and it provides further descriptors of the principles and details information about research that's been undertaken that shows the link between the safety of people experiencing care and the well-being of those delivering the service. Now, the statutory guidance is not prescriptive. This has been written to support everybody that the legislation impacts, so it's the whole of the health care sector and the social care sector. So it's not prescriptive for childminders, but when we read it, we can have an idea of what it is that the Scottish Government were considering regarding each principle. So we've developed our hub page specifically for the daycare of children sector and sections for each specialism, including childminders. So to support the use of this guidance document for the Act, we've linked sections from the statutory guidance to each of the 8 main principles. So please do view our hub page for further support on the application of the new legislation as we approach the enactment date of April this year. So Candice is going to pop a link in the chat, which would take you directly to our hub page as well for childminders. Next slide, please. Now, the current legislation that covers this area is Regulation 15 of the Scottish Statutory Instruments. Now, it's a small paragraph in the instruments which details how providers must have regards to the size and nature of the care service when arranging staffing and ensuring that there are at all times suitably qualified people working in the service. Now, when considering qualifications, this doesn't just cover formal qualifications. This should consider skills, knowledge, and values, and individuals' suitability to provide high quality care based on best practice. Now, the asks of the current regulation are all still present in the new Act. They just go into more detail, and there's a focus on the recognition that, as we all know and appreciate, high quality individuals with appropriate skills, competencies and values provide high quality services. The current expectation is when the Health and Care Staffing Scotland Act comes into place in April this year, this regulation from the current instruments will be revoked. So we won't be using this for regulatory purposes during inspection after April. It will be the new legislation, the Health and Care Staffing Scotland Act from April. Next slide, please. Thank you. So Part 3 of the Act starts at Section 7. Section 7 is the duty on care service providers to ensure appropriate staffing. And again, we're referring to people who provide care for children. So this would be for you to determine how many children you can provide care for as a sole worker. This means that providers must ensure there are suitably qualified and competent people working in the service in numbers that are appropriate for the health and well-being of children, and to ensure the provision of safe and high quality care. So in most cases, ensuring you're providing care for the right number of children depending on their individual needs. The minimum ratios provided by the Care Inspectorate will not be changing at this time for any service in ELC, and that includes for childminders. However, there's still the responsibility for you to determine what constitutes appropriate childcare provision by considering the nature of your care service, the number of children experiencing care, and the needs of those individual children. Next slide, please. So Section 8 within Part 3 is about staff training. Now, the Act states that providers must ensure staff working in the service receive appropriate training for the work they are undertaking, and that they receive suitable assistance for the purpose of obtaining further qualifications appropriate to their work. Again, like already mentioned, this doesn't just cover formal qualifications. This should consider skills and knowledge to provide high quality care based on best practice. If you employ assistants, this is about ensuring staff are suitably trained and that services employ people with appropriate skills, competencies and values. This, for childminders working independently, would refer to you as the provider of care, and the ask would be to ensure your own professional knowledge is up to date by undertaking appropriate training or reading, or engaging with discussions with other childminders or other childcare professionals, with a view to work towards continuous reflection and improvement. So there are some questions on the screen that you may ask yourself to identify if you're meeting the requirements of this section of the Act, such as how do you identify your training needs? Do you find time to consider any of your reading or training to understand how it can have a positive impact on your service or on children's outcomes? And do you have opportunities to share any reading or learning with other colleagues, such as other childminders or other childcare professionals that you engage with? Now, all of these would be with the intention of informing your practice and to ultimately influence continuous improvement within your service. So we're not going to open that one up today. We're just going to leave those ones for you to take home and have a little reflection with. Next slide, please. Thank you. So I mentioned earlier that we've developed our hub page, and that's on the screen just now. So you'll see the poster on the left-hand side, and that's been developed to support all professionals working in childcare to understand the main principles behind the Act. And this poster is available to download on our hub page, and we'll pop a link in the chat for that for reference as well. If we go on the next slide, please. Thank you. So this again is our hub page. I've just scrolled down a little bit for you to show you the different specialisms. So you can click to open up the childminding tab, and this is where you'll find 2 short bite-sized videos to support you to become familiar with the parts of the Act that are applicable to your service. So again, that's part 1 of the legislation and part 3. And also where we've linked the chapters from the statutory guidance I mentioned to each of the 8 main principles, they'll be found here. It's also here that we will post the recording from this webinar and any other future resources. So please do have a look at the Hub page if you get a chance. Thank you. The last support document I wanted to highlight for now is the Knowledge and Skills Framework, which has been developed by the Healthcare Staffing Programme within Healthcare Improvement Scotland and NHS Education Scotland. The framework is to support all staff within the health and care sector to provide a consistent and inclusive approach to learning and development, and to support individuals and organisations in their understanding and application of this legislation. Now, the framework is broken down into 4 domains or 4 learning zones, and within each domain there are 4 skill levels. The modules for the first 2 levels, Informed and Skilled, are currently available on the TURAS site, which is the NHS Education for Scotland's learning and development platform. Now, although TURAS is predominantly an NHS resource, everyone will be able to set up a free account, and we're going to pop a link in the chat for a reference guide on how to register for a free TURAS account. The next 2 levels, Enhanced and Expert, are still being developed. Now, the team working on the framework within Healthcare Improvement Scotland held workshops throughout November to invite comment and feedback to support the review of this document. And I'm really pleased to report that these workshops were really well attended by the social care sector, and there was representation there from the Scottish Childminding Association to act as a voice for your sector. So the resource is being further developed to ensure it offers a good learning experience for both the health sector and everyone within the care sector. So please do look out for the revised framework that should be available soon if e-learning is your preferred way of building on your knowledge of new information. So we're just approaching the end of things that I have to share with you, and we have a couple of questions coming up. But again, as we are a commissioned programme, I'd be really grateful if you could continue with the data gathering processes and just answer this poll to identify if you feel that you are more ready than you perhaps were at the start of the webinar, and becoming more confident with the different elements of the Act that apply to your service. So we'll just give people a moment, and then we've got a couple of other questions about future support that we can help with to continue developing your confidence with becoming aware of the new legislation as we move towards enactment in April. So thank you so much, everybody that's contributing towards this data gathering. I'm really grateful. Thank you for adding that in the chat. So feel free to add that in the chat if you can't access the QR codes. Please stay with us because we do have a couple more questions. If we could just go on to the next question, please, Candice. Thank you. Now, we have covered 2 of the 8 main principles today because we're really aware that we don't want to take too much of your time. Everybody works so long hours. We didn't want to have a 2-hour webinar if you didn't feel that that was necessary. What we are offering is to have a further event on Monday, the 29th of January, again for an hour, and that would be to review the further main principles that we haven't reviewed today. So to again use the AHA platform to allow you to contribute to the other principles so that you can become more familiar with all of the principles, because we do need to look at these holistically. We've just broken these down today to support with your development and understanding of each. So there are some people that would like to attend, so we will put that on. So we'll hold that on Monday, the 29th of January between 6:30 and 7:30. We won't go over the whole Act again. What we will do is just unpick the 6 principles. So it may not take an hour, but we will put that on. So thanks very much for responding to that. And one further question. Thanks, Candice. We felt that this was probably going to come up with a lot of questions after the event, because it's only once you've reflected on learning that I think the questions come up. There are a lot of people on the call today, so we can't open up to a Q&A session, but we wanted to give people the opportunity to go away and reflect on this. So what we're proposing is that we have a half-hour session on Wednesday, the 7th of February, between 6:30 and 7 o'clock. There won't be any agenda for this meeting. This will just be an open session where Candice and I will be available in a meeting if you wanted to come in and just ask us any questions. We will be providing you details in a second to submit your questions to us. So we'll be able to group those into themes to identify common themes that are coming up and have your questions identified. But you will have an opportunity to come off mic, to come into the webinar and have a discussion with us about this. So there are some people that are looking for that and will find that helpful. I know you have a lot in your training plans for January and February between the Scottish Government SAC webinars coming up, and I think the SCMA are putting things on, so I do appreciate that we're taking more of your time in the evenings. Oh, it's your son's birthday. Please do submit your responses. We can appreciate that not everybody will be able to attend. So after this Q&A session, we'll try and develop maybe a frequently asked question report, so that if you do have some specific questions, then we'll make sure that we can answer those. So please do submit them. We're giving you an opportunity in a second to submit those. If you can just pop into the next slide, please, Candice. Thank you. So if you could just answer this one for us, so please advise us what worked well in our session. And we're thinking as well here about the AHA slides. Were they a positive addition tonight to allow you to contribute your ideas? And what would improve your individual learning experience? So if there's anything else we could include for future sessions, or if there's anything else you would like us to do to support you to become confident and continue raising your awareness about the enactment of the Health and Care Staffing Scotland Act, please do let us know. We'll just give you a couple of seconds. So somebody's put in a comment there about not looking for an assistant. So just to clarify that this legislation is applicable for all childminders, not just those with assistants. That's great. Thanks very much for contributing to that evaluation there. That'll really help us to make sure that we get it right for you. I agree. It was also good to hear everyone's input. Absolutely. You're the experts in this field, and we need to hear from you. Thank you so much for contributing to that evaluation. If we can just move on to the last slide, please, Candice. Thank you. So thanks again for attending the session. I'm just going to put my camera back on. I really hope it was helpful to prepare you for enactment in terms of becoming aware of the new legislation. Now, you'll see here on the screen a QR code, and this will take you to a Microsoft forum. And Candice will also add a link in the chat that you can access this forum. Now, there are two sections in the form. The first is to enter your email address, please, if you would like to come along to our next session to look at the other principles like we've discussed. If you could enter your email address so that we can invite you to this once we've set it up. Please also use this form. There's a second question in this forum to submit any questions or queries, and we will use those to group them into themes, and we'll answer these during the Q&A session, because it may be that we'll have 30 people all with the same question. So it would be better for the Q&A session if we can group them and answer them all together. This, like I've said, will be a really informal session with no agenda other than you coming on to hear the responses to the common themed questions that we will then post on the Hub page for those that can't join us. And you'll have an opportunity, like I said, to come into the meeting to ask us a direct question if you would prefer. So this recording will be available on our hub page as soon as we can. But that's everything from me this evening. So I'll leave you now to enjoy your evening, and thank you again for joining us. We really appreciate it. Thanks very much.